So the exciting thing about how we work in a joined up way through integrated care system is there's a different way of doing things. We are in exceptionally challenging times, and the integrated care system offers, I think, a pathway to a better place.
For me, integrated care means providing care to our patients without the barrier of organisations, and to actually just do the best thing for our population to achieve best outcomes.
Integrated care would mean that patients have a seamless journey from the start of their referral all the way through to their discharge process, and that they would only have to answer the silly questions that get asked more than 100 times currently once, and everybody would be able to share that information and manage the patient from that information.
We've spent quite a bit of time in Buckinghamshire speaking to our local people to understand what they really want, and over 18 months the key message has been less complicated pathways, navigating our care, one place closer to home that we can access healthcare, and we have hospitals when we really need it.
Everybody is working to the benefit of that patient on that pathway. So ultimately the patient feels that clinicians understand each other and are talking to each other and have the best interests of that patient at heart, without it being seeing one doctor for the diabetes and another doctor for another long-term condition and a nurse for this, and that we actually give that care together and jointly.
It means quite simply for me one team, looking at how we can provide the very best of care and what matters really to patients in terms of best outcomes and keeping them healthier for longer. I think nurses have and continue to play a huge important role in terms of providing healthcare services. I think we need to challenge ourselves as nurse leaders. How do we start to take that next step of really leading?
Nurses play a huge role. Certainly in Berkshire West, the directors of nursing have actually been absolutely key in driving through the quality agenda and how we might do things differently.
Nurses really understand patients. They're very good at being patients' advocates and patients' voices, so they can truly bring to the table the benefits that the patient could realise if we do things differently. We can work in an integrated way. I think the benefits for nurses and other health professionals is the opportunity that arises for training, for working differently, that they'll be able to move around the system easier and get different skills that they can bring to their roles. It'll give them opportunities to move into different areas and different specialisms and actually do that much easier.
We now need to have a structure and a framework to allow us to be able to really drive and lead some of this really important change for our patients and for the people that work with us.